Welcome. This is Lynn Varco with the Minnesota Alliance for Ethical Healthcare. Thank you to everyone that has tuned in over your lunch hour to join our first in what we hope will be a really remarkable and interesting webinar series related to what our mission is, ensuring ethical healthcare throughout life's journey. Today, we're lucky to have with us Kevin Yuill. I'll talk about him in a moment, but wanted to say that the Minnesota Alliance for Ethical Healthcare is a coalition of 60 organizations, including healthcare providers, disability advocates, mental health experts, faith communities, veterans organizations. We're committed to ensuring better healthcare throughout life's journey, and we advocate for compassionate alternatives to the legalization of assisted suicide. If you already haven't visited, you can learn more about the Alliance at ethicalcaremn.org. And please stay around at the end of the webinar. We're going to have a short call to action related to some of the great things that Dr. Yuill is going to talk about. That will only take a couple of minutes, so please stick around for that. So with that, welcome Dr. Yuill. I'll give a brief introduction, then hand over the floor to him. He will talk for about 20 or 25 minutes. Then we will have question and answers that you can submit through the question and answer function at the bottom of your screen. And you can start submitting those whenever you'd like. Dr. Yuill today will discuss the harms associated with legalizing physician-assisted suicide and how protecting the choices of a few by legalizing assisted suicide would endanger the healthcare choices of all. This webinar will equip you with non-faith-based arguments to oppose assisted suicide and help you propose alternatives to the throwaway culture. As I said earlier, will be a first in a series of short webinars with Q&A to give you a chance to get to know Alliance partners and others who advocate and help us provide tangible action steps to engage state legislators. Dr. Yuill is an associate professor of American history at the University of Sunderland in the United Kingdom. Dr. Yuill is the author of Assisted Suicide, the Liberal Humanist Case Against Legalization, and that is over his right shoulder. He just pointed at it. I can say it is a remarkable book that if you haven't already read, you should pick up. It provides a succinct and remarkable case against legalization of assisted suicide. And again, that's called Assisted Suicide, the Liberal Humanist Case Against Legalization. He has published in the Economist magazine, the Independent, the Spectator, and elsewhere on assisted suicide, which he opposes. An article on the history of euthanasia and suicide in the US, linking eugenics and population control to the euthanasia campaign, will be out next year. And with that, I'd like to hand it over to our guest, Dr. Kevin Yuill. Welcome.
Well, thank you very much for having me and for inviting me. And it's nice to sort of be in Minnesota, although it's 6 o'clock here, I should say. I will talk about three different things. First of all, secular liberal reasons to oppose legislation. Second, what I see as an important delineations between supporters of legalizing assisted suicide and dying. I think that's worth talking about. And third, I'm going to give you a couple of pro tips because I've been in this game for a while. I wrote my first article opposing assisted suicide, as it was then called, 25 years ago, before actually Oregon legalized before it came into effect. And it was in response really to Kevorkian, if any of you are old enough to remember Jack Kevorkian, Dr. Death, but also reflecting on the suicide of a friend in the 1980s. And I've been researching and writing about it ever since. So first of all, I'm going to list, I'm going to try and do this, bring up my screen to share screen. I did this before, yes. So hopefully that will work. And we'll do that. And I will do it from the beginning and there. Hopefully everybody can see that. So these are reasons to oppose legalization. These are what I'm going to talk about. First of all, thou shalt not kill, not simply a religious stricture. Secondly, I think it will legalized assisted dying will divide us between lives worth living, for which we make every effort to prevent suicide, and those who we will offer to push off of the proverbial bridge. Our third point is it's not necessary. Fourth, it's really the beginning and not the end of a process that will stop at 6 months to live. Those safeguards will never be intact if we look at countries where this has been implemented. And finally, it will undermine both compassion and autonomy. So first, thou shalt not kill. This is shared by faiths and by those who have no faith. Consent is not a legal defense against manslaughter or murder, at least in the UK. And assisted dying is either, no matter how you slice it, it's either killing or participating in the killing of a human being. A man who kills himself, the saying goes, does wrong only to himself, and therefore there's no occasion for the intervention of society. For so goes the ancient maxim, volenti non fit injuria. But we no longer believe this, nor do we regard seeing competents kill each other in a forum as entertainment. And I think that I go with very much with the great French sociologist Émile Durkheim, who wrote Le Suicide in the 1890s as a reason why we should be concerned about these things. I'm obviously sympathetic to the suicidal, but regard suicide as generally morally wrong, just as Durkheim did, and just as I think most people would if they are given the choice, if they are passing somebody who is about to kill themselves in a violent fit, we would, I hope, all try and prevent that person. And that shows really that even though if we don't blame these people for doing this, then we at least think that it's wrong. I'm still trying to move my screen along. Yes, there we go. So as Durkheim says, no matter that the guilty person and the victim are one and the same, he's saying this about suicide, the social evil springing from the act is not merely by the author being the one who suffers. If violent destruction of a human life revolts us as sacrilege in itself, and generally we cannot tolerate it under any circumstances, a collective sentiment which yielded so far would soon lose all force. And I think this is absolutely right. People will say, and they have said in talks before, what about capital punishment? And I think there are some similarities. I oppose capital punishment. I am a liberal, but there are some differences. And first of all, I think there's a clear line of responsibility for taking a life when it comes to capital punishment. The governor or the president can save a life. There's responsibility at least involved in that whole discussion. And the process can take an average of 20 years on death row. A lot of people say this is a bad thing. I actually think this is a good thing. It shows that a human life is taken very, very seriously. Even the worst dregs of humanity, for which any sane person would cheer upon the death of, and there are people like that that we might not think deserve to live, but killing them is another matter. An execution is a somber, serious and profound act, and I think that's a difference with assisted dying. In assisted dying, the responsibility lies where? With the doctor, with the patient, but I would argue actually it's with nobody. It actually does not exist with anybody because it's been medicalized. It's been transformed into medical treatment, which I think is a real problem. So my second argument really is that it will erode moral equality, and moral equality is reflected in our murder laws. To kill an 88-year-old cancer sufferer is just as wicked as killing a 24-year-old with everything in front of them. And to kill a profoundly disabled person is perhaps more terrible an act than killing a healthy individual. It's just as wrong to kill a poor person as it is to kill a rich person. It is, or certainly should be, just as wrong to kill a Black person as it is to kill a white person. These lives are, or should be, regarded as equally deserving of protection. And I think assisted dying actually undermines that idea of moral equality. So assisted dying is not necessary. That's my argument. Everybody has and should have the right to refuse medical treatment or food and drink. Anyone with enough determination and planning can eventuate their own deaths. That's very, very possible to do. So, and the article that Lynn referred to that I've just written was discussing about suicide in the 1890s, when it was at a nadir of religion, the real sort of low point for religion in the United States. And many declared that suicide was not a sin, including the second most popular circuit speaker at the time, the great agnostic Robert Ingersoll, but no one called for suicide to be assisted. So although they used examples of people being devoured by cancer in their arguments, nobody was actually talking about the need for suicide assistance, at least not Robert Ingersoll. And even if we keep that in mind, there were much cruder ways of doing it, and nobody had the internet at that stage. And I think that's a difference between today, is that people talk about assisted dying. And I just don't think it's necessary. First, also, suffering is existential rather than directly because of their disease. It's not in the top 5 reasons. Pain is not in the top 5 reasons why people in areas where it's legal actually opt for assisted dying. And existential pain, as we all know, can be alleviated, even if the condition underlying that, the disease or whatever, cannot be. Adjustments can be made. And a final point on that that's not listed on the screen is that very few people have actually been prosecuted under assisted dying laws. This is important because the tendency of the law has been in the past to turn their back on occasional acts of kindness by doctors, which I think have existed. Certainly, that's the way George V, or was it the 6th of England? I get my kings and queens mixed up. That one of those was actually disposed of, not disposed, that's a bit harsh, but their death was speeded up by a doctor who admitted so in Parliament under parliamentary privilege. So the categories of those eligible have a tendency to expand. This is something that's always played down by opponents of assisted dying, or by proponents of assisted dying legalization. They always say, well, the safeguards in Oregon have met the test of time, and that everything about that is good. But we're talking about a very different thing when, for instance, a country is actually involved. So every country, every nation where this has been legalized has been actually, it is expanded. So, sorry, I'm just getting rid of the chat on here. So if we look at every nation, the rules have expanded. Probably the most egregious kind of issues have happened in Belgium and the Netherlands, where children under the age of 12 are now eligible to be killed. That's coming in the Netherlands, but it's been in, and children under the age of 12 suffering from various different conditions have been killed. It's very difficult to argue that that is an expression of autonomy when we don't allow children under the age of 12, strictly speaking, the autonomy to vote, the autonomy to have sex, or other kind of crucial decisions. And yet in Belgium, they're allowed to die. So whenever campaigners have been successful in making assisted dying legal nationally, it has expanded to many other categories. In the Netherlands, there's a large campaign for extending euthanasia to all over 75s who are, quote, tired of life. In Canada, where it was legalized only as recently as 2016, and this is don't look to Oregon, look to Canada. That's what will happen if you get a widespread legalized assisted dying in the United States. If it goes through more and more states until you've got a majority, then you will find that, for instance, in Canada, where it was legalized in 2016, the courts have already ordered it to expand beyond those with what were called, rather awkwardly, I always feel, a reasonably foreseeable death. That has now been eradicated from Bill C7, which is going through the Canadian legislature, or has already gone through, actually, and which includes, of course, disabled people and people with irremediable conditions. So the categories always have a tendency to actually expand. Finally, in this section, undermining autonomy and compassion, undermining the basically, you have the pro-assisted suicide organizations. One's called Compassion and Choices. And these are always a sort of mainstay of their arguments, is that we need to give people autonomy and we need to be compassionate. And I would ask, how is autonomy to have something done to you that you can do by yourself? That seems a sort of basic idea that, everybody is possible. For everybody, it's possible to eventuate your own death. And how is autonomy served by that? At least self-determination, sorry, I've gone too far. Suicide is at least is self-determination. And in the Netherlands, a doctor decides whether to grant requests for euthanasia. And the biggest reason in a recent study I've just looked at why it's declined is because doctors don't have the time. And that doesn't seem a very good way of organizing who deserves euthanasia and who doesn't. So it's always the doctor making the decision. That's not really autonomy. And also, I would argue that the doctor's ability to make very occasional decisions, because I think we need to admit that there are situations where an informally assisted death is actually necessary. I would argue that there are probably fewer and fewer of those, but certainly in the past there have been. And in fact, this is going to undermine doctors' ability to do that by bureaucratizing the deathbed scene, by shining this legal spotlight on the whole deathbed situation, which for me should really remain private. So that's that part done. And I just want to talk briefly about the motivation of proponents of legalized assisted dying, because I think it's important to understand. There are three groups, I would argue. First of all, hardcore proponents. Second of all, those who take up the whole option where it is legal. And I would say those are practitioners. Also, perhaps some of the people who get involved in the whole situation, the groups that volunteer to go and attend assisted dying, but also doctors. And I think the third group is really the majority of the public. And the majority of the public, we have to admit, actually agree on, superficially at least, with legalizing assisted dying. But we have to recognize that they're differently motivated. And that's what I'm really trying to get to. The campaigners who view death as a positive in society, their motivation, which is honestly spelled out by Peter Singer and other kind of people who are putting this forward, is to desacralize human life, or to redefine humanity, to push back the borders of humanity. And this is, they favor euthanasia as a social good, as something, as social efficiency, just as progressive euthanasia supporters at the turn of the century did. And that's from your very own Minneapolis Herald. I thought it was the Daily Elm, but no, it's the Minneapolis Herald, that article that I've got on the side there, where a sociologist suggested that chloroforming poor children was a very good idea. Somebody replied to say perhaps feeding them would be a better idea. But the point is that death was seen as something that was a solution to many of the different problems. So there's a continuum of this core group of people who are very theoretically interested in the whole thing that has continued really since 1870. So they have only espoused assisted dying as something, as a sort of proxy for euthanasia, as a more acceptable version. It used to be the Voluntary Euthanasia Society, of America was, and the Voluntary Euthanasia Society over here on this side of the pond. And that was just considered a more acceptable version of euthanasia for them. Second, I would say there's practitioners who see death as positive for the individual, and this includes the people who actually go through with it. The patients tend to be, I say patients, white, 97% in Oregon versus a population 76% white, educated and used to getting their own way. There's a high proportion of those not married, widowed, or divorced, those who have very, very few social ties. That's who actually is involved. There are very small numbers in Oregon. They're bigger in Canada and in the Netherlands and Belgium, where euthanasia is legal. And that's a very interesting issue, is that why is euthanasia taking off in a massive way, whereas assisted dying, where the patient has to take the final action, is bumping along in these countries where both are legal, chiefly the Netherlands. The assistants, I mean, again, they're often well motivated. They believe in helping people and they believe in what they're doing. And often they're particularly the ones I've experienced in Belgium and Netherlands, and I've been to a conference entitled Euthanasia, where I was invited to speak, which was, I thought, very, very good and very open of them. And they are very disturbed by the fact that anybody disagrees with them, and they see that they are sort of ultra liberals who are leading the way on the path towards a better tomorrow. So that's who tends to be there. They overlap with campaigners in seeing death as a solution, but often it's focused more on the individual than it is on society. And the vast majority of the public, I think, are motivated by a sort of existential fear of dying. And they've often witnessed a bad death, but I think more often they've simply witnessed any death. And deaths today don't tend to be as quick, basically because we have drugs that are able to sort of at least extend, get rid of the pain, but they tend to extend the dying. And most of us, people who've got to my age anyway, have experienced a death, and it's never a very good thing at all. And I think people fear that. There's often a resentment, a secular resentment, and people who associate religious opposition to assisted dying as similar to that of abortion, gay marriage, and birth control. And I would say also that there's an element, and this is controversial, of narcissism in the whole way that we look at death, and we look at, and I mean narcissism in the way that Christopher Lasch has talked about it in his Culture of Narcissism, which is a really interesting and good book. It's a narcissistic age. We don't think of ourselves in a long line of generations, and we don't look to the future generations as carrying on. So I think that's part of it. So I think the other thing that they do is they respond to these stories that are used by proponents of assisted dying to push. And in fact, that's really their only trick, is to tell these terrible stories and say, would you like that to happen to you, to your loved one, or to somebody else? And I think they respond, the public responds to that and thinks, no, why should we? But I think they're much easier to convince than the other categories. And I think that's a good thing. And I'm coming up to 20 minutes, so I have time to do this. So my advice, because I've been in this game for a while, and this is what I've learned. I think the first thing is to insist that the discussion goes beyond religious perspective. This is again, they tell terrible stories and they say it's only these terrible priests, clerics, whoever, imams, anybody who is actually opposing this. And it's these backward faiths that are actually preventing us from doing the humanitarian good thing. And they push that, and then they tell their terrible stories. And I think that we insist the discussion goes beyond these religious perspectives, and that opponents deal with the arguments put forward rather than simply insulting people of faith, which I've heard again and again. And as an atheist myself, I think you should not be, whoever is religious should not be ashamed of being religious. I think you should come out, but you should insist on talking about the issues at hand rather than the issues of your religion. I think we can, just there's an expression in England, you need to take the ball rather than the man. So rather than having this insult of various people of various different faiths, you need to insist that we actually talk about the issues behind. Second, never bring abortion into it. It's not really as related. I have a chapter in my book, if you're interested, about why I support abortion rights but oppose assisted dying. But I don't tend to talk about that. I just think it's best in this discussion to completely leave it out. And also just to probe with questions like, do you think everybody should be able to have assistance? Where do you draw the line between that? There is a central opposition between the argument for autonomy and compassion. If it's autonomy, everybody has to have it. If it's compassion, why do we need them to agree with that? Why don't we, the example comes up again and again, you wouldn't let your animals suffer. No, we put our animals out of their misery. And we do that for a very good reason, because they can't do that for themselves. So there are these central contradictions, and I think it's possible to get those central contradictions. On what basis? I'd also ask, why are doctors more opposed to legalization than the general public, and hospice workers even more so? Why was Elizabeth Kubler-Ross, pioneering author of On Death and Dying, opposed? These are the kind of questions that we can actually get. So I've done my 20-something minutes. I shall stop now. And please, if you have any questions, I'm very happy to answer them.
Thank you, Dr. Yuill. That was a remarkable presentation and walk through some of your basic arguments. Thank you for that. I'm going to ask a first question as the moderator, and I want to reiterate that everybody should pick up his book, Assisted Suicide, right here. Wonderful book. And there's a question in here related to, I think, a bulk of what you do in the book about outlining the history of the assisted suicide movement. So partly I'd like you to talk about that, but then I'd like you to maybe conclude with talking about how this movement relies on what you call moral entrepreneurs who have exploited changes in public perceptions and attitudes about death, and how this assisted suicide movement feeds upon alienation from technology. And that the movement, rather than challenging the medicalization of society, it in fact medicalizes death, presenting it not as something that naturally occurs, but as a treatment option, the result of choice rather than independent circumstances. So with that, maybe you'd like to address a couple of those items.
In terms of the history, I could talk about this for a very long time, but I won't, I promise. It goes back, the first mentions of euthanasia, at least in its modern sense, that implying mercy killing, comes up in 1870 or 1871 in what's called the Birmingham Speculative Club in the UK. But it was picked up on very quickly in the North American Review and a couple of medical journals, but it was never popular. Like, there were very little discussion of euthanasia really up until the beginnings of the 1900s. So euthanasia became a thing really with progressivism, and not really before. And you'd expect it to be, I thought it would be when I was first investigating it, thinking it would be related to what we call social Darwinism of the late 19th century, but it wasn't. Survival of the fittest and everything else like that. It was entirely to do with progressivism and, in a bizarre way, socialism. Saying this as somebody who's more liberal perhaps than some Americans, but it's the socialism aspect meant that you cared about society. So therefore, many so-called socialist characters actually were in favor of making society much more efficient, getting rid of the weak. And, it's very, very similar to eugenics in a lot of ways. It's a sort of parallel in that you get rid of the weak either by weeding them out and getting rid of those who don't want to live and those whose lives can't benefit anybody, or you try and breed out the next generation to improve them. And both of them were very connected. Margaret Sanger, who was the birth control pioneer, was very in favor of, in fact, was one of the founding members of the Voluntary Euthanasia Society of America in the 1930s. And she was also interested in racial hygiene, what was called racial hygiene at the time. And this meant that you weed out the weakest races. So there is a sort of a bad history, if you like, of euthanasia. I wouldn't call people today who are in favor of legalized assisted dying Nazis. I never think that really is a good way of looking at things. Many of them are extraordinarily well motivated and really see themselves as liberal reformers. But so that's in terms of the history of it. Really, the recent history occurred from about 1970. And that's when you had the whole concept of the right to die coming up. And I think a lot of that is to do with people's different viewpoints on technology. There was a lot of discussion at the time about medical technology running away with itself, and a fear that medicine, a real attack on the paternalism of medicine begins around there. And so that's very much connected with the rise of the right to die. So it's been a feature of our life for a while. In terms of the moral entrepreneurs, I think there's always been these people who want to push this boundary. They were kind of pushed away from doing it. So for instance, those who were in the Voluntary Euthanasia Society of America in the immediate post-war period were actually very involved in population concern. There were Malthusians, what we call Malthusians, who think that the human population is too high. So those people, but they couldn't even keep an office open in 1960. That's how unpopular their cause was. And it was in 1970 that it began to grow. But they constantly push these doors. And I think what's happened recently is that these doors have been much more open. People have been much more open. There's been a sort of decline of religious sentiment. There's been a decline of a lot of the social ties that bind people together. And I think they're pushing on these doors, and these doors are, and they're going, oh, this is slightly open, we can push it further and further. I think that's the dynamic. Finally, on medicalization, there's a very good book written by somebody called Deborah Lupton, who talks about areas of life that are medicalized and, that hadn't been previously. And I think death is one of these things. People managed to die without medical assistance in the past. And whereas today, it's almost like death is something that is done to you rather than something that happens to you. And there's this sense that doctors, I put in the book that doctors are the new priests. It's almost necessary to have the say-so of a doctor in order to have permission to go rather than just to do it yourself.
Thank you for that remarkable history that you outlined. I want to get to some of the questions. Remember, for everyone that's on the webinar, there's a Q&A feature at the bottom of your screen, and you can enter a question there, and we'll make sure to get it in here in our next, maybe 10 or so minutes that we have left with Dr. Yuill, 10 or 15 minutes. There's a question here about the UK, where you are, and the process to legalize assisted suicide there. And that, to this point, has not met with success. And so the question is, what's the status of that, and how can we learn from anything that's happening there in the UK about making sure it doesn't become legal? What can we apply here in Minnesota?
Well, we've got a good coalition here, and I'm very proud to be part of it, that is led probably more than anybody else by Not Dead Yet, which is a disabled organization. And they are very effective at getting the point across. And it means that we can constantly question this. It's a very good way of talking about the whole issue. Disabled people obviously look and say, you're going to prevent the suicide of everybody in Canada where it's legal, except people who are disabled. And then we also look at the sort of reasons why people opt for assisted dying in Oregon, and other places where it's legal. And the top 5 reasons are all things that disabled people often experience. Inability, if you were suddenly made disabled, inability to do the things that make life pleasurable, loss of so-called dignity. I like to think of dignity as being something inherent to human beings rather than simply a function of being able to go to the toilet on your own. But often that's sort of talked about as a reason why people don't want that. They don't want that dignity, and so therefore they opt the indignity of continuing to live. And of course, these are issues that very much affect disabled people. So we have led from that. I personally wrote to every single member of Parliament in 2015, and I was also outside of the Houses of Parliament when a massive cheer went up, and our side actually, I participated in as many debates as I possibly could, and I have to say our opponents are generally good about that. Those are the kind of things that we've done in England that I hope you can do there. I think it's more difficult in the United States because it's less centralized. So we don't have a big focus, but we're not out of the woods. We have another bill coming up very soon. There's a private member's bill. In fact, I'm meeting with some people from Parliament tomorrow to try and form a strategy. So hopefully that will stop it.
Great, thank you for that. I have a good question here about mental health. The current bill in Minnesota, like many others in the United States, doesn't require mental health evaluation. Can you address the lack of mental health resources in many jurisdictions and the effect of that on assisted suicide competency assessments? I think that gets to coercion and whether or not it's really a free decision. And especially if it becomes a standard of care, like you outlined, it can almost sometimes be an unspoken expectation that the patient choose this in some situations.
Yes, and I think that's absolutely right. I do think that there is, if you have a culture whereby it's suggested to you again and again, which is of course what happens in the Netherlands. If you read some of the literature coming from there, it's people with, they go to their doctor and the doctor says at the end of every conversation, there is always euthanasia. And of course, there's a pressure on not being a burden. You don't want to be a burden to your family. And we all feel like that. We don't want to be burdens on our family. So there will be an expectation. The only caveat I'd add, though, is that I think it's a difficult route to actually argue that somebody's not competent, mentally competent to do it. You can say that people are depressed when, obviously if somebody said you've got 6 months to live, I would be very depressed and I would understand anybody who's depressed, but I don't think that turns to competence. And as one of my opponents successfully argued, you can hardly argue that somebody's incompetent to make that sort of decision when they're competent to sign a will. So I think that's the caveat, but there's no question that there's a lot of pressure on people to get out of the way.
Thank you for that. Here's a really interesting question about disability and assisted suicide. And the question addresses the following. I'm quoting here, I think more afraid than dying, people are more afraid of becoming disabled. They would rather commit suicide than being disabled, like my son. How do I get people to see my son through my eyes? How do I get people to see his value and how much he is loved? I try to come at it as a disabilities rights, civil rights issue. Is this the right way? Will the general public be more apt to protect his civil rights and versus see his value?
Well, that's why I insist on this, border around humanity, that, we protect the lives of every single person inside that, anybody we define as human must be actually protected in that instance. And I mean, I think most people will respond and say, no, you should not, most people have enough of a sort of moral sense that they would say it's wrong to actually get rid of disabled people. And if somebody's loved, it's just as wrong, or I think it's a difficult one because I'm not sure about the civil rights aspects, because in some ways I think disabled people, and I have disagreements with all my comrades over here who are, or not all of them, but some of them, about this whole issue, because in some ways I think you require discrimination for disabled lives to become whole. You know, putting up a pavement or something like that to make people's lives better is the right thing to do, but that's in some ways a discriminatory aspect, I suppose. Anyway, in terms of the civil rights, I think emphasizing the common humanity between all of us is the main thing. And I would certainly say that about your son as well.
Thank you. Here's our last question, and then we'll, as I said at the beginning, we'll have an action item for everyone here on the webinar to how you can take some next steps right here in Minnesota to ensure real care throughout life's journey. So here's the final question. It regards older adults who certainly would be susceptible and are susceptible to laws and states and countries where assisted suicide and euthanasia is legal, susceptible to various kinds of unethical treatment. So here's the question. Given the high number of deaths in care homes, particularly in Belgium and Canada, this is referencing during the pandemic especially, do you think there is a connection between assisted dying / euthanasia de jure legalization at the national level and neglect of older persons that leads to the de facto deaths in care homes?
Yeah, I mean, I certainly think that there is a sort of antagonism in some ways against the elderly, or at least a cultural sort of attack on the elderly. I noticed this with the whole boomer discussion and various different other elements that you might see. And there's a sense, particularly, that the elderly are in the way. I noticed this, politically with various different elections, both in your country and in my country. When people voted for Brexit, there was talk of, well, they'll all be dead soon anyway, so we can get back, and which is very, very disturbing. And of course, there might have been a bit of a parallel with that with the Trump vote. I haven't paid close enough attention to it, but I do think that there is something that was demonstrated in Texas, whereby there were, disabled people who were put with do not resuscitate notices, and this is, people with a mental disability, and there's no physical disability at all. That happened in the UK, that happened here. So therefore, I think legalizing assisted dying in that kind of an atmosphere, whereby there's little value placed on the elderly, would be a very dangerous thing.
Thank you, Dr. Kevin Yuill, author of Assisted Suicide. It's the liberal humanist case against legalization. Thank you so much for your time today.